So the overarching goal of this project is to promote tech justice through online safety and digital health skill development. So to start, I want to provide you with a summary of the problem that was identified before creating this implementation project. What I was observing was that the digital world was evolving and changing at a rapid rate, and at the same time, social workers were not actively embracing digital literacy skills and application into practice, which was in direct contrast to the social environment around them. So from this observation, I noticed two problem areas. The first was a lack of digital literacy assessment and intervention in social work practice. And then secondly, there was a lack of digital literacy skill development and training for social workers. So after an extensive literature review and needs assessment, it was clear to me that there was a lack of any training curriculum. So due to this lack of evidence-based intervention, I decided to develop a training curriculum from the ground up for this capstone project specifically. So I completed an independent study and spent 3 months in the summer developing asynchronous and synchronous training materials. The first step was to create a training website, and I have also put that into the chat if you'd like to take a look at it. And that provides training videos, foundational information prior to attending the synchronous portion of the training. It also included an intro to digital literacy, to digital resilience, and how to navigate technology that they were going to be using in the asynchronous platforms to actually learn from. I also created a private Facebook group, and this was created to continue to expand on the foundational information that they received through the website, but also stay connected through staff during their training process and after the training to help support them, because as we know, the digital environment is evolving at a rapid speed. So we have to stay really current and connected to one another so that we can continue to learn. Lastly, I developed a 3-hour training entitled Online Literacy and Digital Health of Our Youth, where I provided foundational online literacy terms and trained staff on how to administer the biopsychosocial digital assessment. All of these training materials were grounded in the trauma-informed, neo-ecological, and digital resilience theories and frameworks. And it's important because these theories and frameworks really provided a perspective from a self-awareness and self-monitoring stance rather than a fear-based abstinence approach to online literacy. So implementation science was used for this project as well to implement the intervention at the Finger Lakes Child Advocacy Center. And it was implemented to increase the staff's confidence in providing digital literacy assessment and intervention to build digital resilience in youth. So in implementation science, you choose an overarching process model to guide the project. So I chose the knowledge to action as the overarching model for this project, and I chose it because it was built with a systems perspective and the ability to assess the need for adaptation in a real world setting. So then the next piece was to choose a theory of change. And so I chose the COM-B theory to address the capability, the motivation, and the opportunity to create change for staff at the Child Advocacy Center. And this theory of change model helped develop implementation interventions that supported the staff in those 3 areas. So then along with the COM-B, the theoretical domains framework, the TDF, and the consolidated framework for implementation research, the CFR, were also used to identify barriers and facilitators to the implementation project. So these barriers and facilitators were considered during all stages of the planning and evaluation of the intervention. So also in implementation science, it's really important to identify what the model calls the who of the intervention. So for this implementation project, the direct who of the intervention is mental health staff providing trauma treatment and intervention to youth. And why this is important is that the overarching goal of of the project is to help clients, but this specific intervention was created to help the staff gain the skills so that then they could help their clients. As identified before, the TDF and the CFR frameworks were used to identify the following perceived barriers to the intervention to help address them proactively in the implementation planning stages. So I considered these barriers when designing the implementation strategies and interventions. And also the barriers were identified with mental health provider input through a needs assessment and focus groups. So the 4 barriers were that staff do not feel confident using online learning platforms for learning their own skills. Staff did not believe that they had the capacity to assess digital domains in clinical treatment. Another barrier is that the digital environment is ever changing at a rapid rate. And lastly, there's a lack of research-informed digital literacy training curriculums specifically developed for staff providing clinical interventions. Along with the barriers, the TDF and the CFR frameworks also helped identify facilitators. So these were areas that would help the implementation be successful. And these areas help me plan, and I use them proactively in implementation planning stages. And these were also identified with mental health provider input through those needs assessment and focus group. So staff expressed that they were interested in learning digital literacy skills and incorporating digital assessment into treatment. And also the Child Advocacy Center already had a continuing education program that provides CEUs to staff, so the training could easily be embedded there. So I used a mixed methods pre and post survey to collect data on the research questions. 16 participants participated in the intervention, and 16 completed the pre-survey and 14 completed the post-survey. Unfortunately, I didn't have an identifier, so I could not remove the 2 pre-test surveys that were not connected to the post-test score, which can impact results. But I conducted t-tests, and here are the mean scores, and the results showed a promising trend in implementing online learning delivery models for this capstone project. As you can see that the averages increased. So I wanted to share a few results from the intervention questions. And again, I conducted t-tests, and here are the graphs showing the means of the pre and post test subscores. So all 3 of these subscales of technology competency, participants' positive view of social media, and digital literacy scores all showed a promising trend for the intervention as the average of all these specific subscales increased. Some of the other subscales stayed the same or only increased by a bit. But I am going to continue this research to continue to explore and find more specifics about why that was. The overall digital literacy score result, which is again an average of all those subscales, shows an overall promising trend for the intervention. As you can see here that the mean and average scores have increased. Like I said, I'm going to continue this research and research the intervention specifically to evaluate its effectiveness and adaptability into other mental health environments. So upon reflection, I will adapt these 2 specific components for future research projects. So I want to create shorter synchronous training sessions to break out the topics being assessed more clearly for participants in various social work settings. So the shorter, more focused training modules will aim to increase accessibility, and participants also noted that this would work better for their schedules. So the goal is to acknowledge how busy participants are and to work to provide shorter training sessions. Also, having monetary incentives for participants is a way to show appreciation for their time and commitment to the data collection and intervention pieces. So in the future, I would like to increase the incentives by gaining funding for the project.